Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us this morning. Before we begin, I'd like to thank our sponsors, Studio Arts and Glass and January Appraisals and Liquidations. Today, Brad and I are broadcasting from our administrative offices, and our guest is Angela Rademacher, Director of Pharmacy and Coordinator of Clinical Services for Medicine Center Pharmacies. Good morning, Angela, and welcome to the show.
Morning, Paul. Thank you for having me.
The role of a pharmacist has broadened, and at the Medicine Center Pharmacy, it has become a destination for patient care. Medicine Center Pharmacy continues to be an ideal place for the healthcare advice, recommendations for over-the-counter treatments, and now for point-of-care testing. Perhaps you have a high deductible insurance plan and you're looking for affordable health screenings and lab tests. Maybe you're looking for opportunities to improve your health and develop a relationship with a healthcare professional. We are your pharmacy this morning, and we're going to talk about Angela and discuss the affordable healthcare screenings and lab tests available at the Medicine Center Pharmacy, along with opportunities to develop a relationship with your pharmacist, a valuable member of your healthcare team. We'd like to remind our listeners today that our program will also be available on our podcast, and you can download that from the App Store in your favorite podcast app. Just look for Health Matters with the Medicine Center Pharmacy, and please subscribe to our program.
So, Angela, welcome to the show. Please tell our listeners a little bit about yourself and your background. And I know that you graduated from Ohio Northern University, my alma mater.
Yes, Paul, that's correct. I graduated from Ohio Northern University in 2018. I got my PharmD, and I also did a minor in biochemistry. I went to Louisville High School, grew up here locally. And after college, I worked for 4 years at Camden Village Pharmacy, which is an independent pharmacy in the Dayton area. I recently moved back up here, and I'm excited to start working at the Medicine Center and be serving the community that I grew up in. In my off time, I enjoy spending time with my husband, and we have a 2-year-old son.
And Angela is our newest staff pharmacist, and we welcome her to our company. So, clinical pharmacy is a unique specialty. What drew you to this specialty, and what do you enjoy most about your work?
I really enjoy working with patients one-on-one. That's what drew me to clinical services. And clinical services give me the opportunity to have that one-on-one time with patients and really get to know them. So whether it's doing a consult, an appointment to manage a specific condition a patient has, reviewing all their medications, or even a point of care lab test, it gives us the opportunity to sit down and develop that close relationship and manage the patient's care.
So, everybody knows that pharmacists are a valuable member of the patient's healthcare team. I know that you're available for questions and consultations. Can you talk to our listeners about these opportunities?
Absolutely. Pharmacists are trained in disease state management and drug therapy. We're often referred to as the drug experts, and we oftentimes have recommendations on how to optimize patient therapy. We're always available to answer questions about medications, whether it's the patient calling the pharmacy to talk to us or just walking in. We provide medication reviews for patients to help them with their therapy. And then we also have that point of care testing that you can walk into the pharmacy and have a lab test done and monitor how well your medications are working and do health screenings.
So members of our, many of our listeners have high deductible insurance plans. What lab tests can you perform, and how will those help our listeners save money and on out-of-pocket expenses?
So I can talk from personal experience on high deductible plans because we've had them. But what the Medicine Center Pharmacy provides is in-house, we have an A1C test, which is for monitoring blood sugar over a 3-month period of time. It's good for patients with diabetes and also screening for diabetes. We have lipid panels done in-house so you can get an idea about what your cholesterol is. We also have thyroid panels so you can look at how well the thyroid medications are working. And then we also have some other tests that we are hoping to bring to the market. But the really great thing about these tests is that they start at $35. So if you're on a high deductible plan like I've been, you don't have that office visit, which alone is way more than $35. And then you just know what you're going to pay. So with the high deductible plans, a lot of times we were really nervous about what was going to come back as a bill because you didn't know what the cost for something was until you already had it done and you got the bill through the mail. And then all of our testing is done with a finger prick, so there's no big needles. That's very nice as well. In general, the point of care testing at the pharmacy is a very cost-effective and convenient way to be involved in your own health and know more about your own body.
I'll add to that too. You mentioned, the cost before you go in. I mean, in the patients that I've worked with too with lab tests, I mean, some don't have any insurance. And it's a welcome choice because it's cheaper than going to the lab. And many providers have referred patients to us at the Medicine Center because it helps them if their patients can get some lab work information to give them more information when they're treating their condition. So, whether you've got a really high deductible plan or maybe you don't have an insurance plan at the moment, you can easily get your A1C or your lipid panel or a TSH test. And for not a lot of money, you can kind of do a little health check and see where you're at. So, my dad, when he started the company years ago, we always did free blood pressure checks on the last Thursday of the month. I mean, screening's important. You need to know your numbers. So whether it's blood pressure or cholesterol, it's important you know those. Angela, how about we talk about how quickly patients receive lab tests, and about, can we send them to the patient's physician?
Sure. So if the patient does a test at the pharmacy, they get their results for the ones done in-house right then and there. So you can know your A1C, you can know your lipid results within about 15 minutes during your appointment. And we can send them to your physician if you provide us with who your physician is. And then you also get a copy for your own records. Anything we send off to the lab, so like the thyroid test or vitamin D test, those would come back in about a week. And again, we can also send that to your physician if you provide us with their information.
What is the process for a customer or a patient to set up an appointment for a lab test?
So the patients have two options for setting up lab tests. They can either go to our website at any time, and that's www.medshoprx.com, or you can call whatever location you want to go to, and they will help you set up an appointment. And we have lots of appointments available, and we can usually get patients in by at least the next day.
All right. Angela, we always have commented that pharmacists are the most accessible healthcare provider. Can you talk about what it means to the customer and when you're available to talk to patients?
Yes. So that's one of the many things I love about our profession is you can walk right in and talk to a pharmacist without an appointment. So if you have any questions, you can just come in or you can call and you get to go straight to that actual healthcare professional, and we get a chance to interact with our patients frequently. And I don't know any other healthcare professional that's this accessible. It really helps us build great relationships with our patients.
It does. It is one of the most rewarding things. Angela, I also know that you are certified to provide long-acting injectables. Can you talk to our listeners about what exactly that is? Because it's not a very descriptive term, even though that's the healthcare lingo. So,
sure. So a long-acting injection is a medication that is given in a muscle, and it lasts anywhere from 1 to 3 months. And these are specialized medications. So they're available for mental health conditions. There's also like birth controls or a vitamin B12. So it is something that we have to be working with your physician on. But if you're on any of those medications and wanted to get them at the pharmacy, it's something you could either call and ask us about, or you can ask your doctor about if there's the possibility to get that at the pharmacy. So these medications are really nice for patients who prefer just to have 1 or every 3 month injections instead of taking a pill daily. But they also have to go to the office generally to get them administered. So we have started the program of administering them at the pharmacy, just for the convenience of the patient, that they have different hours are available, and maybe it's even closer to their home.
Welcome back to Health Matters with the Medicine Center Pharmacy. Did you know we offer free prescription delivery? Call your Medicine Center Pharmacy and learn about our prescription delivery program.
All right. One of the things we haven't talked about, since there's been a lot of focus, we'd mentioned vaccines before the break. Let's talk about COVID vaccines. But what other vaccines can we provide at the Medicine Center Pharmacy?
We actually offer a variety of vaccines. We have shingles, we have the tetanus, we have pneumonia, we even have Gardasil and hepatitis. And of course, we do have the flu shot every year when it's time for that as well.
And
Yeah, I think
in the Corona series, or we're still doing boosters and some other things, and the demand is still pretty heavy. So
yeah, it is. It seems like Moderna is the favorite given the press lately still, but it is, you can walk into the pharmacy anytime and get one of these vaccines. If you want to call the pharmacy and ask more questions, you certainly can do that. I was thinking, Angela, also, it might be an idea. One of the things I think that can be intimidating for people when they have to have blood drawn for anything or go to a provider, can you give us an explanation of what it's like when a patient comes in to get like a lipid test? Can you describe what their best practice is, and do they need to fast or not, and how long the appointment takes, and just maybe what they can expect to ease any fears of the unknown?
Sure, Brad. So they do recommend that we have the patients fast before a lipid test, but you don't necessarily have to with our test either. So what we do is the patient would make their appointment either on our website or call us, and then they would just come into the pharmacy, and there's a very short form they fill out to give consent for the test and a little background information. And then we have a little clinical area we go to where it's got all of our supplies and some seats. Patient sits down, we clean their finger with an alcohol wipe, and then it's just a little prick. And then we get the blood off that little prick of the finger, and then we load a tube up with their blood and we put it in the machine, and it's all done right there in front of the patient so they can see what's going on. And then the results print out, and we put the results on that paper. The patient is given a copy, and then we would send the copy to the provider if the patient has one that they want it to go to. And then we keep it in our records as well. So then if 3 months later you've lost your copy and you need to know what your numbers are, you can always reach back out to us and we can provide you with that information.
and also, don't we offer a free meter program and
Yes.
for people who suspect they have diabetes or pre-diabetes, correct?
Yes, so we do offer free meters. We actually have a really nice kit that comes with just about everything you need to get started. So anyone who is diagnosed with diabetes, they get the meter itself, the test strips that go in it, the lancing device, and the lancets, which are what you use to actually poke your own finger. And then we have glucose tablets, because diabetics, especially new diabetics, can have their blood sugar go low. And we want to make sure they have something on hand to correct that.
Well, some of our current surveys show that many of the other pharmacies are offering glucose monitor strips for $50 to $100 a bottle. And we are, with our monitor, I believe we are somewhere right around $7.50, as I recall. That really makes a huge savings in examining, because some people do test three times a day and some 4. So it's amazing that we've come up with that. And that happened to be one of the people in our company that came up with that program. And we have been handing out meters and strips now for, I forget how long, Brad, 3-4 years, maybe longer.
It may be longer. It seems like it's been longer, but yeah, I mean, it's a nice way to economically keep track of your numbers. So I guess our theme today, I think, is kind of know your numbers, whether you're testing at home or you come to us to get a lab test, don't be afraid to know what the bottom line is. So
We had individuals come to us and say, Paul, the cost of glucose monitor strips per month for me almost prohibits me from buying some additional food items for myself. So that's when we started to think, we got to do something here with this. And that's what we did. And that's what we got going right now. And it really is a wonderful program. So, and I got another question for you too, Angela. What service do we offer that you wish more of our listeners knew about?
Paul, I really wish our listeners knew more about their point of care testing, because as you guys were saying, knowing your numbers is so important in being involved in your own health. And I think it's a really great opportunity for our patients to get to know their numbers at a cost-effective and convenient way for them. So hopefully some of our listeners will get some benefit from all the topics we've covered today. And I really do agree with you about the meters, that it's very nice how you guys have made that affordable, because even with patients getting the meters through insurance, some of them are limiting the number of times that they can test, and they just need an affordable backup meter because our diabetics need to know their numbers.
I'm with you on that. And it really is the program has really helped identify some individuals that have pre-diabetes or diabetes. What is pre-diabetes, by the way?
So pre-diabetes is when you're not quite classified as diabetic, but you're really in the danger zone of being there. So it's that opportunity for us to correct it before it becomes diabetes, the opportunity for lifestyle modifications to bring your sugars back down, because once you enter the diabetes, there's no going back, and it has lifelong consequences, and it becomes a lot more difficult to manage at that point.
Many people drink a lot of soda, pop, whatever it's called in this world anymore. And it's not uncommon for a sugar cola, to have like 12 teaspoons of sugar in a bottle. And I'm thinking, whoa, you drink a couple of those a day. Where's your blood glucose with that? If you have pre-diabetes or if you are a diabetic. And there are two types of diabetes. They've changed the terms of them over the past few years. What are they now?
So we still hear it called type 1 and type 2, but you can also hear them referred to as insulin dependent and then not insulin dependent. So it depends on which healthcare professional you're talking to. But
Sure.
type 1 diabetes is the type that patients are born with, and they will need insulin replacement throughout their life. Type 2, we can manage in other ways as well.
Would you agree that pharmacies have been one of the main players in identifying blood pressure in individuals with high blood pressure and individuals with diabetes, pre-diabetes, all that sort of thing? Those are the two things I think that we as a pharmacist and pharmacy have really helped solve and find.
Sure. I think that our screening programs have really helped people know more about their own health and identify these issues before going to the doctor. Because a healthy person goes to the doctor maybe once a year, and that's not enough to really catch the blood pressure. So if they want to just stop by the pharmacy and get their blood pressure checked, it's easy to do. And then some of it is they're just more comfortable in the pharmacy, that if you go to your doctor, you're nervous, your blood pressure does come up, and then they just keep an eye on it to see if it's really high or not. So I do think the pharmacy has a lot of value as far as screening goes.
Sure does. Any further questions, Brad?
I just wondered if you had a short story that maybe you're fond of, where you did a screening for someone that had a problem and were able to really make an impact on their outcome.
So the most A story like that would be when we were screening for blood pressures. We just had a health fair and we did help identify high blood pressure before they were due for their physician's visit. And it was a jump start on getting it treated because blood pressure is what we do call the silent killer because you don't feel it. You just have to check for it. And untreated blood pressure has long-term consequences and even deadly consequences. So it was really great to find that for someone so they could get treatment early and then go on and have a happy and healthy life without any of those long-term consequences.
Excellent.
I think we're about ready for the news, right, Brad?
Yep.
Thank you, Angela, very much for coming on the program this morning. We really appreciate you taking time from your busy day. How can our listeners reach you and if they want to talk to you about or schedule an appointment?
Thank you so much for having me. It's been a pleasure. If anyone wants to talk to me further, they can call any of our stores and they will help get you in contact with me.
Welcome back to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. We have a lot more to cover this morning, so let's get back to the show.
All right. We'd also like to introduce Colton Miles, Doctor of Pharmacy. Colton manages our long-term care pharmacy at the Medicine Center in Louisville, as well as care of all of our patients who request our Easy Dose Packs. Easy Dose Packs are easy to open packets containing your medication, and they're sorted by dose, date, and time. They make it easy for you to follow your doctor's treatment plan, and best of all, we make sure that you've got refills available. We also offer free delivery if needed. No more hassle sorting your medication, messing with pill boxes, spilling bottles, or carrying a plastic bag full of stuff with you when you travel. You can call in for refills or making multiple trips to the pharmacy is all simplified. So we do all that for you at no additional cost. It's all part of our patient care program.
Good morning, Colton. Welcome to the show. Take a moment, please, and introduce yourself to listeners.
Good morning, everyone. My name is Colton Miles. I'm a 2014 graduate of Claymont High School. From there, I went on to Ohio Northern University, where I met my fiance and graduated with my Doctor of Pharmacy degree in 2020. I have been with Medicine Center Pharmacy for about 2 years now, and I've enjoyed every minute of it. My fiance and I will be getting married this fall, and along with our Golden Doodle crew, we recently moved to the North Canton area.
Lots of mail order pharmacies offer similar services. What makes our service better, and why do you recommend Easy Dose Packs to our customers?
So although these mail order pharmacies offer similar services, with Medicine Center Pharmacy, you get the opportunity to talk with your local pharmacist to fully customize your Easy Dose Pack. If you have questions or concerns, you can call us or come into the pharmacy and talk directly with us without having to wait on hold for extended periods of time. Our Easy Dose Packs are packed locally at our Louisville location and can be delivered to New Philly, Minerva, Louisville, Canton, and even North Canton, Massillon, and Alliance. I recommend our Easy Dose Packs to any patient who's tired of sorting their medications or having a hard time remembering what medications to take and when to take them. And just for those looking for an easy and convenient way to organize either their own meds or medicines that they manage for a family member.
So Colton, can you show and describe us an example of an Easy Dose Pack and how to read the packet, how to open it, and how we try to help patients take their medications at the correct day and time?
So our Easy Dose Packs offer an easy to read and simple to use packaging for maintaining any number of medications. Each individual baggie is labeled with the patient's name, medication name, strength, prescription number, and directions, as well as the date and time that the patient is to be giving or taking the medication. In addition, each Easy Dose Pack is packed in a special Medicine Center box, as you can see here, and then also on the box, there's a list of the patient's medications with the same information that you would also find on each individual baggie. But it's also just a good reference to have on the side of the box. And it's also important to know that you could take it with you to the doctor's office as just a reference. What makes these Easy Dose Packs so special is the ability to be divided by time of day. So morning, lunch, afternoon, evening, and bedtime are our most common times. But we can work with you to further customize your pack. For example, the Easy Dose Pack I have here today has 3 morning packs and 1 bedtime pack. It is important to always verify the patient name, date, and time before taking or giving any medication, just to ensure that the correct person is getting the correct dose at the right date and time. As long as everything matches, you can easily separate our baggies due to the perforation between each baggie. Once the individual baggie has been removed from the rest of the pack, you can easily tear open to access the medications. So for example, if I look at today, I got my 3 baggies here. I can tear off my 3 morning baggies. I can confirm that it's for my doses for this morning, and then I can easily hold up my baggies here. I'll do this on the camera here just for purposes. You can easily tear open the baggie and easily have access to your medications to be given at that time. I can now verify that my next baggie on my roll is for this evening. And I can tell that by looking at the date and time that's on our baggie. So this is just an example of one of our baggies here. And like I said, it's got the information about the medication itself, a description, the dose, the name of the medication, and the number of tablets that should be in that baggie.
You know, I guess if I could just interject, it's one of those things that I think we get a lot of calls in the pharmacy about people and caregivers that are having challenges with people's medications. I mean, if you start to take more than 2 or 3 prescriptions and you've got to take one at 8 a.m. and one at noon and one at 6 p.m., it doesn't sound like a lot, but we're all busy people. And, you know, whether you're working your day job or you're taking care of your kids or your grandkids, sometimes it's a lot to manage. And then you forget, did I take my dose at dinner time? And I think the easy dose packs are great because you just mentioned you look at your next dose in the sleeve. If your noon dose is there and it's 2 o'clock, then you know what? You can call us at the pharmacy and we can advise you on what to do next since you missed that dose. Generally, we'll give you the best recommendation on what to do, depending on how long it's been since you missed that dose. But I think, as Colton's mentioned, it's important for you to be able to have that relationship with a local pharmacist. We can help you troubleshoot those things. I mean, you don't have to pick up the phone and wait on some call center for half an hour while they maybe or maybe don't solve your problem. So, you know, I know, Colton, we can do a number of different things for patients. Sometimes it differs for patients you take care of in assisted living or group home facilities. But for a patient who stays in their own home, how many days medication do we normally pack at a time for them to have on hand?
Yeah, we prefer to send 28 days of medications at a time. This just allows our patients to follow an easy routine. So for example, a patient who picks up on a Monday or is delivered on a Monday would continue to do so every 4 weeks. So it follows a nice schedule every month. And this allows our patients to make planned trips to the pharmacy once a month, regardless of the number of days in that month.
Well, I think that's important for consistency because if you know that the first Monday of the month is your day, then it's a nice reminder in your mind. But you know, we haven't talked about it yet, but one of the things that our patients can do to Colton or our staff can do, do you want to touch on how we make sure we check in with patients to make sure they have everything they need in those packets?
Yeah, so part of our patient care program involves contacting the patient ahead of time. So we try to do about at least a week, especially with our easy dose packs ahead of time before the pickup or delivery date, just to ensure that we have everything we need to be packed and have it all ready for the patients at one time. If we don't have everything we need, and when we talk to the patient, we can tell them that, as well as contacting the doctor for any additional refills that we may need, or also organize for a different date that we can deliver or pick up if the patient's maybe going out of town or something like that. So by contacting the patient ahead of time, it allows us to plan for what we need to do to get those packed, but as well allows the patient to kind of be on the same page as us and kind of keep that communication line open.
What about vitamins or medications that you can get over the counter? Can we put those in the packs?
We can, if you have over the counters or vitamins that you would like to be included in your easy dose pack. As part of that conversation, we would work with the patient and their provider to see what we can do to get those included in their easy dose pack.
What about easy dose packs being child safe? I mean, they are just a plastic little Ziploc thing, right?
Yeah, so unfortunately, they're not considered child safe. So it is important to continue to keep them in a safe, secure location away from children or animals that you just wouldn't want to have access to these medications.
And how do we handle meds that cannot be included in the packets, like an inhaler, insulin, things along that line?
Yeah. So with these medications and others that can't go in your easy dose pack, we still work with the patient to get everything lined up for one pickup date. So again, as part of that patient care program, when we contact the patient, if there's anything extra that they need, like you mentioned, inhalers or injections, we'll do our part to try to get the refills and get it filled on time to be delivered or have ready for pickup with the easy dose pack, although it cannot go in the actual pack itself.
There's a fair amount of prescription drugs and other items that are only taken as needed. How do we do that?
So with as needed medications, we typically avoid putting them in the easy dose pack just to allow the patient the full capability of truly taking it as needed. Similar to the inhalers and injections as part of the patient care program, we would be in constant communication with the patient, realizing that if they're not taking it scheduled every day, it might not always run out or need a refill at the same time as their scheduled medications. So we would just be in constant contact. And if we have to refill that at a different time, we could, but we try to do our best to keep everything as lined up as possible.
It's time to our break. Take a break, Colton. You're listening to Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. Thanks for joining us. Let's get back to the final segment of the show.
Easy dose packs make life simple for customers who have jobs that require them to travel frequently, or family members who may have difficulty remembering to take their medication, or simply for those of us who are tired of sorting through our medications and supplements. Colton, do you have any favorite patient success stories that you'd like to share with our listeners?
Yeah, one example that I can think of was one of our patients. She was getting multiple medications from, I believe it was at least 2 different pharmacies. She was making multiple trips a month to each pharmacy and just was having a hard time keeping everything organized and on track. Once we got all of her medications transferred to us from those pharmacies, we were able to work with her and her family to get all of her medications due for refill at the same time. And once we were able to do that, we were able to provide her easy dose pack medications. And now we deliver to them to her once a month, saving this patient all that time on the multiple unnecessary trips to the pharmacy. In addition, the patient now has that easy to manage, simple to read, accurate way to organize her medications.
Interesting.
Simple is good, isn't it?
Yeah.
So tell me, how much do we charge for easy dose pack services?
So there is no additional cost to have the medications packed in the easy dose pack. The only thing the patient will be responsible for are their current copays, which is going to be the same whether it's in the easy dose pack or in the bottle. So we charge no additional costs to have the medications pre-packed in our easy dose pack.
So, what can listeners do today if they decide that they need to make a change? How can we help them get enrolled in using our easy dose pack program?
Yeah, so if any of our listeners would like to get set up on the easy dose pack program, you can call your local medicine center pharmacy, or you can call me directly. Our number is 330-875-9090. And my team and I would be happy to help guide them in the right direction. It would be beneficial for them to have all their information ready, including their name, their current pharmacy, and what prescriptions they would like to be included in their easy dose pack. And that would make the transition from their current pharmacy to us as seamless as possible. If they have any questions or would like to see a model before switching over to the easy dose pack program, they're more than welcome to stop into any of our locations, and one of our pharmacists would be happy to provide them with a demonstration or a sample that we have on at the pharmacy.
It might be of interest for the listeners to know that this particular service really didn't start for patients in their own home. Can you talk about what other facilities and healthcare organizations use easy dose packs?
Yeah, so as you mentioned, me and my team are responsible for managing our long-term care pharmacy, which originated to care for assisted living facilities, group homes, things of that nature. And that's where our compliance packaging originated. We've now started to push all of those facilities over to the Easy Dose Pack program. And it helps save time in those facilities and in those group homes, not only for the nurses, but just on our end as well, helping to keep things as organized as possible. It helps to reduce the amount of cards, 30-day cards and things like that, other compliance packaging that they could use is now all in one roll, basically. So that's kind of where we got started with these Easy Dose Pack.
What about I maybe one other little tidbit of information to share is medications are ordered by your physician to treat your underlying condition, whether it be high blood pressure or whether it be cholesterol. Can you talk about consequences that patients hopefully don't have, but could have if they regularly miss doses for high blood pressure medication or high cholesterol medication, and what the goal is of our compliance packaging to help prevent that?
Yeah, to have the medications packed in the Easy Dose Pack just means that ideally the patients will be taking the medications exactly as the doctor had prescribed at the right time, the right frequency, meaning that's amount of times per day. If a patient was to be taking meds out of a bottle and not taking them as accurately as possible, it could lead to increased doctor visits, increased health problems, increased medications to treat those health problems, and the cycle can just go on and on. So by getting our patients enrolled in this Easy Dose Pack program and ensuring that they're taking their medications on time is hopefully saving them money as well as the healthcare system money in the long run.
Don't you think that, okay, there's a fair amount of people that take 3-4 meds a day out there, and even more than that. And don't you think this is really the best way to not forget to take a med? Like, okay, so you got all different kinds of directions, 1 4 times a day, 1 3 times a day, 1 2 times a day, 1 a day, or 1 every other day, or whatever. Okay.
Yeah.
Is not this the best way to solve that problem? And you know what? I take a med that I take every other day. And I'm going to tell you right now, remembering taking that med every other day with some of the other products I'm forced to take is sometimes a real problem. Hey, did I do that? Did I take that?
Yeah.
What do
Yeah,
you
that
think?
brings up a really good point. Medications, especially that have weird dosing, what I would consider weird dosing for our patients, is like you said, every other day, and those ones can be very hard to remember. But even those types of medications can be packed correctly in our Easy Dose Pack, so it kind of takes the thinking out of it. You don't have to really remember exactly what day did I take this last, as long as you're verifying the current day and time on your Easy Dose Pack. The medications would already be packaged correctly for you. And as you mentioned, having 3-4 meds, I think that's really for any patient with any number of meds, or even patients with just one med and who travel a lot and just want to have everything kind of in one area and easy to kind of grab and go. Easy Dose Pack provides a good option for that.
One of the labor categories that I think we've heard from are long haul truckers who, have maybe blood pressure and maybe a couple of other meds or something like that, that it was an issue of remembrance for them while they were driving. But here's this box sitting beside you with a strip package in it. And that box in itself is a reminder that, hey, I got to take these meds, okay, at a certain time of the day. And we have heard that from, I think, 3 or 4 truckers, which I thought was very interesting.
Yeah, it also just takes out the possibility that, for example, one of those truckers leaves a bottle behind, and now is kind of already on the road and is out
Yeah.
there and has no way of getting another refill. So by having everything already prepackaged in one roll, one box, it kind of eliminates that potential to forget things.
Mm-hmm.
Well, to take that one step further too, if you're going out to lunch with friends, you can take your lunchtime pack with you and stick it in your purse or your pocket. You don't have to worry about carrying a pill box or bottles. Or if you're going on vacation for a week, you can take your 7 days. You don't need to take all 28 or 30 days. So
Hmm.
a lot of
Yeah.
flexibility. So it's really kind of
Yeah.
cool.
And the nice thing I think I forgot to mention with our Easy Dose Pack is we also write the dates of that dose pack on the box. So it's easy to see when exactly you are going to run out of meds. So if you are planning a vacation, you can look at that and say, well, I might need to give the pharmacy a call maybe a day or two early because my pack might run out the day that we're leaving and I want to pick it up a couple days early. So really the box just provides an easy reference to everything that's related to that patient's medications.
You know, some people listening to us talk about this might think, well, gosh, I'm going to have 12 boxes sitting on my countertop. But if you're taking the same med 4 times a day, we're going to package them in the same zip package. Am I right?
So it's going to be each time of day. So if they take one in the morning, one in the afternoon, one in the evening, they will each be in their own individual baggie. But the way that we were able to roll up these medications and put them in a box, we can fit a fair amount of medications in one box. There are some instances where we may have 1 or 2 boxes, but we would write the dates on that box for what that pack contains. So if it's the 1st of the month to the 15th, we would write that on the box, and then the rest of the meds and dates would be written on the other box, and kind of allows that patient to again know what meds are in each box if they were to have 2 separate boxes.
I believe we're very close to being out of time here, Brad. Further questions and anything else, Colton?
Nothing that I can think of. I'm just looking forward to having the opportunity to work with more of our listeners and patients to get them packed in our Easy Dose packaging.
Okay. Thank you to our guests today, Angela Rademacher and Colton Miles. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to our sponsors, Studio Arts and Glass and January Appraisals and Liquidations. As always, we thank our listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you right here again Friday on News Talk 1480 WHBC.